Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Chief Medical Officer and founder of Atlantic Coast Aesthetics, Dr. Thomas Pane. Dr. Pane, we have a question from one of our viewers this week. It's a male tummy tuck question. So looks like the person here has lost a lot of weight. They've had gastric sleeve surgery 5 months ago. They've lost about 75 pounds, and they're considering a male tummy tuck with a six-pack. They're curious how does this process work, and just wanted to hear your opinion on the subject.
Well, good one. And again, in men, tummy tuck surgery is almost exclusively done when someone has lost a lot of weight. And that could be through diet and exercise or bariatric surgery has been more recently common. In this case, it's only been 5 months since the surgery. So we want to see, is the weight stabilized? 5 months is okay, but usually we want to see people go about 6 to 12 months, sometimes longer, depending on where they are in the weight loss process. If someone is completely leveled out, tissues are thin, it's possible to consider it at 5 months. In most cases, you're going to want to wait a little bit longer. In terms of getting the so-called six-pack, if the skin, the anterior abdomen is fairly thin, then what's going to happen is the muscle definition is going to show underneath. That being said, there are other ways with liposuction of trying to define the musculature. It's called abdominal etching. I don't recommend doing that at the same time as an abdominoplasty because you are asking for trouble with the healing. So what I would say is do the abdominoplasty when the weight is stable, get as good a result as we can, and then options for defining the muscle, they may be defined already depending on how they are and how thin the skin is on top of that. Other things could be considered down the line if needed, but in general, single procedure is going to do it, and then with some exercise strengthening those muscles, that definition should be seen if the tissue on top is thin enough. So that pretty much covers the overview here, and should get us started in the right direction.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page or website. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.